someone coming up behind me and hitting me, like I'm like checking out for it.
My sister used to do this similar thing, but she used to like karate chop people in the neck.
That's different.
Right? We could.
Look how excited she is to be sponsored by Blooms.
That would be everything, honestly.
You would love that.
I tagged them in my stories to try and get them to
Blooms.
be posted.
This is the hardest working, most hustle-oriented person I've ever worked alongside. I call her Mighty Mouse. And all she runs on is Blooms every single day.
It's true.
Sponsored.
Raspberry lemon, specifically.
Please. Thank you.
Yeah.
And it's also why she has TMJ problems. Hey everybody, this is Dr. Warren. I'm a chiropractor here in Baltimore, Maryland, and I like helping people out with a lot of different problems. One of those problems that I see often in the office is temporal mandibular joint dysfunction, TMJD, or TMJ, as people call it. Okay, let's see. Night guards oftentimes are prescribed early on by your dentist, which help protect the teeth. And maybe in some cases it provides some functional relief to the jaw, but most often it initiates the bite even more, and people wake up with soreness in their masseters or their jaw. Oftentimes when you have temporal mandibular joint dysfunction, or TMJD, it's usually unilateral in pain and presentation, but functionally how we address it, it depends on where they're stiff and where they're, we'll call it hypermobile, or the noisy joint. And so when you wear a night guard over and over again, it might present in a certain way, of like stiffness on both sides or trigger points in the muscles on the side of your cheek. And so every case is different, is basically what I'm trying to get at. And then we do a lot of things that help but don't often get to the root cause. That's probably the oldest but truest story that I hear about all different kinds of ways. Like getting your energy from a can of Bloom. All right. But I get it. Oh, I get it. I was like, we had one espresso worth of coffee left in the house this morning. My wife and I were like
fighting. Yeah. Wild West style.
Wild West style.
Yep.
And I made it, and it was perfect. And I took a sip, and I was like, honey, I'm gonna share this with you. She's like, you damn right you're gonna share that with me. She's a little bit pregnant right now too, and we got 3 kids, so she definitely gets the most of that cup of coffee.
Sharing was wonderful of you.
Share your Blooms with us next time. We scooch on
always.
up a little bit for you. All right, so real quick, I'll show you how I do some work on the jaw, or we can just sit and talk about energy. No, we'll get to work. Okay, so do me a favor, open up. I'm gonna look for least and last with her, okay, which I see on the left side. Oftentimes I'll correlate that with some neck issues as well, but I'm gonna get right to action here. So go ahead and open. I'm gonna work on her pterygoids. You can close. And we're gonna do a little bit of muscle release, a little muscle energy work in the back, myofascial release, a lot of different names for it, just depends on what your profession or title is. Open up for me. Good, I'm gonna hook right into this tendon right there, okay? It might be a little tender when I get back into it, okay? Open up wide. Good, and close. All right, we just get things rolling here. We'll do 4 reps. Go ahead. And close. Do it a little slower this time. Pop me off you. Go ahead, go. There we go. Little tender spot right there. I want to hang on that for a second. Close. Open. Good. Cool. Now let's go round 2. Close. All right, it's just like any joint. I'm gonna look at it from a lot of different angles and directions and movements. I'm gonna address some of the structures around it, and then functionally I'm gonna think about like why is this happening, right? Is it a mechanical thing from the neck open and shoulder, or is it Blooms? Close. I know, Nicole, it's probably a little bit of both, but probably more on the Bloom side. Open. Either way, I can make a local effect to affect a systemic change in the body and still provide her with a lot of relief and a little happier of a jaw. Close. But if I ignore the other side of things, then open, I will just keep running this problem, and we'll go crazy in here. Just keep repeating the problem over and over again. Open. Go. Close. Alright, open. I could spend like an hour working on someone's masseter jaw and all the muscles to it. Save it. I'll show you a little bit of a light. So that's pterygoid work in the back of the mouth, going on the tendon, doing just opening and closing. Don't have to do any deviation from that position, but I will go and I'll affect those muscles that help deviate the jaw in just a second. Go ahead and open up for me nice and wide. It should feel a little bit like nicer already.
Yeah, it doesn't. I don't feel the popping as much on the left side. Nice.
Go ahead and open for me. And then I'm gonna put my thumbs right down on her molars, down gently, close, don't bite my thumbs. And you're just gonna feel your muscles engage, and then just go ahead and open up wide. Good, I'm gonna do a little gentle stretch. She has such a, honestly, smaller mouth, so that I'm just gonna go ahead and do it from the bottom here. Go ahead and open. Gently close. 2, 1. And open. I'm going to stretch you a little bit, okay? And I'm going to palpate. Just relax for me. There we go. So I'm going to palpate the joint as I'm rolling back and forth. Good, and relax. Go ahead and open again for me, nice and wide. And close, cool, I got you. And then open. And then relax. Let it fall down here for me. You're going to feel a little stretch on the left side of your cheek, like through here. So let your jaw hang. Open and hang. Carly, you come on over here. I'll show you what I'm doing. I'm pushing her chin down to here. She's still kind of like the jaw, it's so hard to relax your jaw. So she's not there yet. I want you to think about your chin coming to my thumb over here. There you go. Perfect. Now she just dropped in this place. Now you'll actually feel a stretch. Good. And then push your chin into my finger that's pushed on you. Not to Carly, more to my hand. I know it's a hard one. This hand right here. Yeah. Good. But don't kick your chin out so far when you do it. Just go straight to the left. It's hard. Good. And then relax. So a tight muscle is hard to control. It feels, and there you go. Good. Now let it fall back down to where it was. Oh man, you got it. Good. You're going to feel a stretch down on your cheek here a little bit, okay? And so my hands will move pretty quick here for this. This is an adjustment to the TMJ joint. And her occiput on her right side. So let your body fall. Good.
That was good. Oh. Delicious.
Okay. Talking about blooms or that adjustment?
Both.
Cool. Okay, so then I'm going to go ahead and repalpate. Open for me, nice and wide, and close. Good, I'm going to do a good big stretch here. Open nice and easy. Good, and close. Open. Close. Good. I'm going to push straight down. So open your mouth a little bit for me, and I'm going to just basically gently glide the joint backwards, and you're going to push up into my hand. Perfect. Oh my God, perfect. And then relax. So excited for you how well you did that. Feel like push up again. Really good. And relax. Gentle stretch here, yeah? So relax it open. Now let me just glide you down. Good. Push up. And relax. Let it glide down. Good. And go ahead and open for me. And close. Good. We're going to come over and hit these pterygoids and masseter, open up wide and let it drop to the left. It's going to be a little hard. harder to do on this side. Push your jaw to the right. Good job. And let it drop to the left. Big stretch on that masseter right there. So I just hooked my heel of my hand down across, just in front of her mandible, coming off into a trigger point in her masseter. And I'm just putting a little feedback into that to get it to relax. And a really nice healthy stretch there. Good. Okay, let's do that again, hon. Go ahead and let your chin drop. Good. Push your chin to your right. I'm going to stretch you after you let it go. Ready? 3, 2, 1, relax. Good job. Good. You're going to feel a little release here, okay? Nothing too quick. Good. Now open for me. Good. Close. And relax. A little release there and there, okay? Good. Open up for me. And close. Good. Alright, so we just did... How does your jaw feel, by the way?
Amazing.
Okay, so we did some master stretching, more like a pterygoid side glide. The chin straight back is a form of a Mackenzie stretch on the joint itself, so I'll teach you how to do that, kind of to create a little bit of a stretch on the capsule, see if it helps alleviate some of her tension and stress there. I've been working on her neck. You've seen me adjust her neck, doing some manipulation there relative to where she's restricted in her joints, but also there's probably a little association with being tighter along this region of her left side of her neck and jaw. And I'll work on that. Relative to all of that, in conjunction with a little home stretching and return, I'd probably see her, because this is my first time working on her jaw, twice a week for 2 to 3 weeks, see how she's doing with what I gave her and what I'm doing to her, and I should see start a pattern unfolding and changing during that time, ideally, especially if she's kind of limiting some of the factors that create some of that stress pattern as well, okay? I've been treating her for a little while, and her spine, her upper back, her neck, and her lower back, periodically. She's a tough cookie to crack, literally, relative to some of the adjustments, so I had to kind of change things up a little bit with her, even though she don't look like she's tough, correct? So I'll show you how I did it. Create a lot of flexion here. Tuck your chin. Good. Good, and then rest. I'm gonna bring you on up. You're gonna follow me. I'll show you how I do an adjustment. So full spine adjustment for it right now. You'll get to see that as well. Come follow. You can sit right here and put your feet up top. Here you go, easy. Come down. Good. Relax your shoulders. There you go. And then interlace your fingers for me. And go to Cabo. Relax down. Easy. So I'm going to create pressure over your TL junction. Awesome. Good. So interlace your left. Come follow me. TL junction. So lay on your stomach here. What I was saying was where I was adjusting her is where her thoracic spine meets her lumbar spine. Just in that junctional space in flexion. If you're wondering. And there are some that wonder. Alright, now you get to relax. Look forward for me a little bit. Relax your shoulders. And get comfortable. Get your necklaces out of there.
It was the mic.
You good?
Yep.
Okay.
I was really sore out there today.
Been lifting more, haven't you?
I have been.
That's awesome.
Today my glutes are on fire.
Did you do a hard workout over the weekend?
Yeah, yesterday.
Good for you. Keep getting it. Stay in it, girl. There you go. So, we've got 5 chiropractors that work here, and we have a massage therapist, 6 technically. 6 chiropractors, 1 part-time. We have a nurse practitioner, a couple other interdisciplinary practitioners coming in to join us in the next month, which I'm excited about. But the people that keep the office moving, patient care dialed in, and really supporting a lot of us in terms of what we do from a practice standpoint. People like Nicole, and the 7, 8, 9 sometimes other wonderful people that help keep the flow of this office going and supporting our patients.
When you press on this side,
Yeah?
my elbow gets tingly.
Yeah, you got a little trigger point right here.
Oh, I ain't never felt that before. Right there is okay. It's a little higher. It's so weird.
So I like to take care of them, is where I was going. And I'm happy to do that for them on our lunch shifts. So that's what you're seeing right now. This is someone that works in my office. Probably didn't explain that. And she does a great job of helping us and supporting patient care. Does a lot of the modalities in the office for our patients.
Yay.
Oh, you keep it nice and smooth. Lie on your side, this side up for me. Please, thank you. And thank you for what you do here, Nicole.
Oh, of course.
There you go. Rest.
Oh, that was beautiful.
I'm on your side, face that way for me.
Whew, that was a good one.
Good. Back.
Yeah, it's that glute. That one hurts.
Let it fall.
Oh, beautiful.
Back. All right, so we've talked a lot in terms of what she's been doing, movement-wise, fitness-wise, routine outside of here. From a treatment standpoint, I'm gonna start focusing on her. I'll help you out a little here. Her jaw and her upper cervical spine. Work on trying to find some balance and some of that deviation and some of that clicking, popping, but a lot of just general stress in that area, which will help a lot with some of the pain that she feels. I see a lot of TMJ problems come in the office. A lot of people think that you can address them, but it's like anything. It's like an area of stress and pain in a joint and muscle that can be affected through some of these services, right? Really commonly. As well as some course correction. Keep course correcting. Take care of yourself. Feels good, doesn't it? Mm-hmm. Sweet.
You could stay here for all day. How about you? Oh my God, like it's burning, but it feels so good.
Take a breath and relax.
You saw me rolling my hip today.
Today, you?
Yeah.
While you're working? You got their phone rolling? Oh, against
remember?
the wall.
Yeah, you saw me with the ball.
Yeah.
Oh my God, it's because I was doing a laser and I was like leaning and I literally felt my whole glute start to spasm. I was like, no, not right now. We got too much to go.
So yeah, that massage ball is kind of a little tricky. A nice little
I
trick
have
to
one
in
at
the bag.
home that I've been using, so luckily that's been nice, but
Yeah.
today was just on fire and I did that laser. Oh, I was like, I don't know if I can do that again. I'd roll it out. Oh. How you crack my fingers and I don't cringe is crazy to me.
Why, that usually bothers you?
Yes. My friend used to crack my fingers in middle school and I used to almost cry every time. I hated it.
We're circling back on that trauma, don't worry.
Yeah.
We got you.
And it's not even that it hurt, I just don't like cracking my fingers. I'm not one of those people.
Man, I used to play this game in middle school and elementary school, where you would just, it was like Frogger or something like that. You just tag the person on the back of the elbow with your knuckle, just like a punch.
Oh, and it jolt them?
Yeah, you jolt them.
That's hilarious.
But like, it was a thing for like 2 years. And like, I still feel like someone coming up behind me and hitting me, like I'm like checking out for it.
My sister used to do this similar thing, but she used to like karate chop people in the neck.
That's different.
Right? But like, all her friends were doing it too. I'd go pick her from school and I'd see them doing it. I'm like, oh, you do this?
Yeah, it's weird.
I guess they got more vile as the generations got older.
Yeah, it's karate.
Karate chopping people in the neck. I don't know. Yeah. We just used to play tag.
Oh, I feel you. Okay, have a good shift off. You're welcome.
That's great. Well needed.
Thanks for watching, y'all.
Thanks for watching.
Hey everyone, Dr. Angie here, and we have student Dr. Kendra with us. So she came up to me earlier and she goes, I'm having this weird rib pain. She was pulling needles from a patient and just randomly felt some pain. Go ahead and turn for me. Like right around here. So like underneath that scapula. And I'm gonna have her do the same thing I did earlier. Go ahead and lift your arm for me. So I'm trying to isolate, see if it's something that's related to her shoulder, to the muscles, to the scapula, all of her pretty hair out of the way. Go ahead and bring it up to the side. And so we're not really getting much change with it as we move, but go ahead and twist for me. Twist your upper body. That's where we feel it. So we get more of that irritation. A lot of times with rotational movement in that area, we're still getting more rib fixation that's going on. So oftentimes with rib irritations, you're gonna get difficulty to take a really deep breath in. You're gonna feel that pain. Sometimes it's more central to the spine. Sometimes you can even feel it kind of penetrate through, almost feel like it's chest pain. So I've seen people before where they're like, I thought I might have been having a heart attack. Should I be worried? Is it angina? Something that's gonna be more problematic, but then we adjust them and we talked about the rib fixation, and that's the issue. So we're gonna go ahead and treat Kendra here. I'm gonna have you lay face down for me to start. Awesome. And we're still gonna get some of her mid-back adjusted just to make sure everything's aligned in that regard, where that rib articulates with the spine. And then if we need to, we can do a little bit more specific to the rib. And because it is a little bit lower, I'm gonna use my lift for you. All right, so right in here we get some of that fixation as well. Go ahead and take a breath in and breathe it all out. Good. She's a super easy adjuster. Makes our jobs a lot easier. Cool. And then that lift I'm talking about, I'm gonna be on the other side of the table. I do a lift here from the hip, and I'm gonna apply a little pressure here. Just want you to try relax. Little lift and twist. Good, one more. There it is, nice. Cool. Other ways we can do that adjustment are laying face up, and it's usually for the higher ribs, it's easier to get in that area. But for hers, it was right down in here. Still might be a little tender just from the muscles. There's muscles between your ribs that can articulate in that area, or can, I would say, tighten up in that area. So we still might have some tenderness. The other thing we're gonna do for her today is laser. All right, bringing you back up. And that's a treatment for rib fixation. Cold, sorry.
The Mothman costume. You could always cut that. Carly, make the camera wear glasses, please.
Make the camera wear glasses? Do you?
Does everyone have their glasses on?
I guess I should put on mine, even though I don't really know, but you know.
I almost stopped you, by the way. Mid-video, because when you said pulling needles, it didn't process I'm allowed to pull needles, but you can't push them. So right away I was like, well, you can probably see my face in the video. You're like,
I'm gonna do 4 minutes, okay?
I know the concept. The problem is they feel like everyone's sewing machine and we're always got together at the conference and decided to just
Son of a gun.
that was a very fast 4 minutes.
Because like
Did I even sleep?
my mom was sewing
I don't think I got my nap in. Another 4 snooze. Another 4 minutes.
something, whatever. Same for friends. I knew you were sewing machine. I do have my grandmother's sewing machine. It's like I do it all. I literally remember. I'm hoping maybe that one might be
It's so weird that it vibrates and it's like angry.
Yeah, I know.
It's in case you're blind and you're operating the device. And you can't see when the light goes red.
I always wondered, like, patients can't feel it.
The vibrating.
It's
You
very
didn't feel
light.
it?
No, it's super light. So
I'm gonna roll this up a little bit more.
sometimes patients won't even know.
That's good to know.
Ooh, that's tender.
Tender like a chicken.
Yep.
Alright, you okay with those? Sure. Alright, I guess I'm here for 10 minutes and then do exercise. Okay?
Okay. This is the type of treatment that makes you want to go to sleep.
Ribs are also just a tricky one to go over just because there's not much, like surface level. It's very superficial.
When you get like closer to my spine and then you go outward like right in there, that's when it like right there. Yeah, that's like
The tender spot.
uh-huh. Yeah.
Not getting too warm, is it?
Nope, it's comfy.
That's good.
Disturbing her nap.
Yeah, how much longer do I have to nap?
54 seconds.
It's like when we finish, we set a timer. Another 10 minutes just to hang out with the needles.
Just to let her rest with it.
Big needles.
It feels bumpy.
You have bones.
I didn't know.
I was gonna say, I was like, you yourself are not bumpy. You just have bones.
I thought you were going to tell me I have strong muscles in my back.
You also have those. You have strong muscles and knots in your back.
Yeah, that's true.
That's true. Now that I made you say what I wanted to hear, that is true.
That's very true. Thanks, Dr. Angie.
You're welcome. There you go.
Thank you.
You can lay there for a bit. No,
Sick.
let me unplug
Okay.
the machine
She
before
said for
I
a
try
bit.
to roll it away.
I'm just gonna
Okay,
keep.
bye.
Okay, there.
Hey guys, it's Sven here in Towson, Maryland. I'm with my favorite patient, Christy, and Christy and I go way back. This is our first time really treating a pretty significant ankle sprain. So this year I thought Sven was, circle back, Frozen, okay? There's a movie, and there's two of them I think, and I'm watching Frozen 2, and I'm like, oh okay, this is our shtick this year. This is our family's kind of get up. We're all going to be parts of Frozen. I thought Sven was like the big Swedish dude that rides the reindeer, and then my wife pulls out the reindeer costume, and I'm like, oh, I'm the reindeer, huh? Okay. And my kids are like, get down. And so I've just carried kids around all Halloween now. Princess Anna, not kids, Princess Anna and Princess Elsa, which has been fun. So, Chrissy and I go way back. She actually did some artwork for my first Scarlet, which was really fun, and I have that up in her room. And then, as well as of Cam and my wife, a picture of Cam looking at the bump, which is one of my favorite pictures. We go way back. She's done some artwork with me. She's got a high ankle sprain and lateral ankle sprain, so we treat that here in our office. Doing some soft tissue work, doing some using acupuncture needles to do dry needling around the tissues that she aggravated during the injury itself. It's about a week old. It's already started to bruise, which is a good sign, so it's signs that she's healing. She's also getting some therapy on the tissues afterwards, after she gets the dry needling done. And then I'm doing some soft tissue work and starting to mobilize the joint a little bit. So, can you take me seriously with this thing on, Chrissy?
I always take you seriously.
As long as you feel better, that's all I care about.
You know I'm always laughing when I leave.
Yes. So we've got, we're a weekend. I think that a lot of times people get ankle sprains and we get this recommendation off the bat, boot, rest, 3 to 4 weeks, sometimes longer, and we'll find we get better results a lot sooner. We got her into tennis shoes within like 3 or 4 days after the initial injury, and just moving and walking comfortably, not aggravating it, but moving to a point where she opens it up and loosens it up. So there's definitely an art to healing of applying movement and treatment in the right way and manner early on. So we take this 3 to 4 week turnaround and we put it down to a week, and we really speed things up. And then ideally on the back end, just doing the right things from a load standpoint so that she's got good recovery down the road. All right, ankle sprains 101, right there, baby. Boom. So we've got everybody in costume today.
Everyone looks good.
Who do you like the most?
I haven't seen everybody.
You haven't seen everybody? Okay.
No.
Oh, I see what you're doing. And then who so far?
I'd have to see you carrying around the princesses.
Oh, yes, that's definitely a part of my outfit.
Yeah,
for sure.
you're only half complete.
Who so far have you seen that you've thought, oh, that's a good one?
Beetlejuice.
Brady's Beetlejuice
Yeah.
is phenomenal.
He's so tall.
He's such a big dude, I know. He's got his newborn in here right now, and I'm like, this kid's gonna be a giant just like Brady. Lymphatic sweep, some soft tissue work on the top, and then I'll get into individual tissues. Just try to get her to relax a little bit. It's hard, it hurts. I know, sorry. There you go.
I'm trying.
I know you are. I appreciate you. Yeah, sorry for the discomfort I'm causing. It's all in good aim.
No pain, no gain.
No pain, no gain, baby. Pain's just weakness leaving the body.
That's right.
That's one of them, for sure. That'd be the truth. Yeah. Good. Bring your toes back for me. Nice. And toes down towards me. Good. So the first week, this is the majority of the work that I'm doing. It's kind of just nice, patient lymphatic sweep in, and then I'll get in and I'll individually strip different tissues, the fascia in that area. Chrissy, how do you feel after I work on it like this? Not during, obviously.
I know that it's definitely healing faster than it would normally.
Go.
I feel like I have a lot more range of motion when I leave.
Good. So same, better, worse when I work on you. Afterwards, my goal is always obviously better. Some sessions will be a little bit more intense and she might be a little rocked for a day or two, and that's okay too. So it's not always like, oh, that wasn't that bad, I feel great, and sometimes it's like, okay, we really dry needled, I'm sore,
Yeah.
right? And we're stimulating that response, but we change the treatment. It's not cookie cutter each time. And then rest. It's hard to sit with this one. It pulls my head back. It's a little too tight for me. I'm excited to say that our team is growing again, and we've got a new chiropractor joining us in January full-time, so we'll have 5 chiropractors, and then we have a preceptor joining.
That's awesome.
Yeah, and we've integrated our practice, so we've got primary care, regenerative medicine now part of what we do.
Yeah.
And it's really tailored based off of the needs of Dr. Jeff.
Well, that's nice.
Everything that he's needed, we created in the environment of the office.
I like that.
And then it's just also served our patients. It's worked out really nicely.
That's awesome.
It's fun. It's been really, really fun to add in the clinical steps, stay conservative, really drive people towards the gym, and or and kind of meet them where they're at too, like what they're looking to accomplish. If it's just a place to rest and recovery, and injury management in that capacity, stress relief, and then that's what you see me for, right?
Yeah.
Stress relief right
Stress
here.
relief.
This
Yep.
is very stress relieving for you.
Very much so.
No, I got you. Pull your toes. Good. Curl in towards me. Good. And toes back. Yeah, partnered actually with my wife's group, Insight Therapy, so she's got a mental health practice. And so we use them for the real mental health treatment, not what I'm talking about. But there is something to be said about body work that's very relaxing.
Very much so.
Yeah, right on. Are you ready to get to work for real?
No.
We're still in the light phase. It's all good. So we're located in Towson, Baltimore, Maryland. I went to school. Father's a chiropractor. That's Dr. Jeff. That's who I was just saying. And I joined his practice about 8 years ago. Got maybe one future chiropractor below me, I think. One of them might be a chiropractor.
Yeah.
Yep. My oldest is kind of getting into it a little bit. We'll see.
Nice.
It's funny. Either way, I've got a kid standing on my back at the end of most nights, telling me they want to massage my back.
Take a deep breath.
Yeah. And relax right there. I gotcha. And then like sumo squat, butt bounce right on the back.
There you go.
Here you go. Good. Bring your toes back. Nice.
I think I'm gonna have more movement in my ankle than I did before I sprained it.
Let go, baby. Let go. I'm trying to get that win. Let's go. There you go. Bring your toes back for me. For maybe, I don't know. This video. What's this video for? Why am I doing this? Right? It's interesting the people I've run into in this world. Whether it's this random kid down in Costa Rica that liked our videos and has been a fan, right? That's so cool. I love that.
Yeah.
And then I met a lot of students in chiropractic school along the way that have used them for education purposes, and like to get an idea or a concept of what practice looks like or injury management looks like, because you do get it in school, but it's nice to see real world stuff.
Yeah.
So some of the dorsal ligaments I'm working on the back, I'm taking my fingers and I'm pulling through, and I'm creating dorsiflexion and eversion in her foot, and that creates a stretch on those tissues, so I'm going to hook those fingers in there. And then I'm bringing her toes back gently. And this is where the ankle gets sheared in most eversion sprains. But she really, inversion sprains, but she was really toe heavy when she fell and she strained it. So that's why you see this pattern of bruising through the top of the foot. Come back for me. Good, back down. And then I'll work on calcaneofibular ligament through here. This is another really hypersensitive area. Now you're going to point down and in. Usually the mechanism of injury really puts a little stretch on that. Hold, compression, reduces swelling, helps with pain management in the tissue. From a fiber orientation, a scar tissue starts to get laid. It helps it orient it in the right direction so it doesn't get bound up, stiff later on. It improves the function of the ankle. And then I'm going to go through the extensor retinaculum. I'm going to work below and above that. Straight down at me. Good. And so as you can see, every time I've kind of intentionally put pressure on some of these injured sites, it's a little uncomfortable in those areas. So I'm not going crazy on them right off the bat, but I'm definitely warming up. I've added pressure as I've gone on in this session. And it's just allowed me to kind of get a little bit more depth. I'm going to work on some of these tendons, these peronei, tertius, and some of these muscles that help extend the foot itself. Just gently sweep through some of these areas. Sorry, Christine. There's a lot of swelling here, not a lot of space, super sensitive to pressure, but she's doing a lot better with it. And then I'll go through and I'll hit posterior tib. Hit as in I'll do pin and stretch through the backside, and that'll help take some pressure off this ankle and calf. Good, you can see some of the swelling and the pulling through here from the ligamentous and the strain, the shearing that happened right here. Blood usually pulls like a week or two later. Hers came pretty quickly, which is a good sign. All right. And then I'll go to some of these points above. We'll palpate for trigger points, do ischemic compression for 60 to 90 seconds. That's all the hand work that I'm going to be doing with her, okay? And then I'm really encouraged to try to walk slowly and with control, exaggerate the gait. The more you shorten up the step, I feel like it really doesn't aid in recovery in these kind of cases, not all the cases. That's what I recommended in her case, and it does loosen her up after a while. I'm not going to sneak any adjustments in, I swear. Good. So that's a session of soft tissue work on a sprained ankle. That's I say a week and a half.
Week and a half. Mm-hmm.
Okay. And then we've got some at-home stretches, exercise that we're doing, some PT in here as well. We'll follow up after 2 to 3 weeks. I'm going to do a lot more with her next week. She'll let me most likely. And from the regenerative side of things, how we would manage this, there comes the sun. Peptide therapy, PRP, and the ligamentous strain that she has as an option. She has an MRI scheduled for Monday that we sent her out for. So we'll find out what's happening from a detailed standpoint. I can take diagnostic ultrasound and evaluate like today if I wanted to, but she's responding well to care, and we're not in those phases of making a decision there. We're just trying to become a little bit more ambulatory, get her back to work as soon as possible, safely.
Very much so.
Cool. All right. Hey everybody, this is Dr. Warren here at Kelstein Chiropractic. I'm with Nicole. Nicole, you've been in the office for how long now?
7 months.
7 months. We're gonna do a little video for the people.
Sounds good.
We're gonna talk about Dowager's hump. And a lot of people come into the office and one of their chief complaints is they get upper back discomfort. They get the rounding of the shoulders. They get tension or discomfort in the spine and in between the shoulder blades.
Sitting at a desk.
Sitting at the desk, sitting on the phone, sitting on the TV.
Driving.
Come on, a couple different areas where we get it, and we deal with it quite a bit from a standpoint of pain, but we also give and educate people on ways of dealing with it on their own, of managing it. So let's just back up. What is Dowager's hump? What is this concept of this this rounding of the shoulders? Let me explain it from an anatomical standpoint. Okay, so you've got 3 areas of the spine. You have your cervical spine, your thoracic spine, and your lumbar spine. The Dowager's hump is mostly concerning the mid-back, even though the whole spine is going to be affected in essence, okay? Specifically the neck. And so for the cervical spine, when you have Dowager's hump, it's going to be pushed forward a little bit more. You're going to lose this natural C curve, the secondary curve that you have in your neck that you develop, and you might see someone with their head forward and up a little bit more, okay? When you're in that position, it just naturally puts more stress there. Your body is, your head is being supported by this area of your neck more as opposed to by your whole frame, okay? And then specifically the hump itself, where people see in the mirror or feel the tension or discomfort, and sometimes when the body is abnormally stressed over time like this, it gets irritated, it gets overstressed, right? And so you'll see a T1 or T2, a thoracic vertebrae 1 or thoracic vertebrae 2 prominence. You'll see this kind of pointy spot that's kind of coming out a little bit more this way, okay? And what's happening around that spot is your shoulders are rolling forward and in, your pecs are tight, okay? And the rest of your upper back, like your upper traps, okay, are tight as well, all right? And so there's things that we do in the office relative to managing that. So when people are in pain, we might use dry needling. When people are in pain, we might use class 4 laser. Those are modalities of treating irritated tight tissue. For the stiff joints, we adjust people, that's for sure. We do soft tissue work and massage, manual therapy. So I'm going to show you how I adjust Nicole. And Nicole does not have a Dowager's hump. She's got some discomfort in between her upper back. She just had a long day working here, helping patients out, doing all those modalities we were just talking about in the office. And a lot of positions like, say this. All right. So, you know, it really kind of covers a lot of different professions, if you will, in terms of experiencing this discomfort, including a chiropractic assistant. Hey, you.
Hey.
All right, Nicole, so go ahead and sit there for me. I'm going to kind of show people what I feel for relative to palpating upper back discomfort like this, okay? So from a scan standpoint as well, from a movement standpoint in the joints, I'm going to motion palpate her thoracic spine. When I do get to Nicole on this, and I've been working on Nicole's back for the last couple weeks, and Nicole is a little tighter through this upper back area. She's little, but she's mighty. Okay,
I am.
She packs a punch in here. There's no doubt about it. And so this is an area and spot that we've been. I've actually been dry needling on her because she gets a little irritated up top here, and doing some soft tissue work on her as well. And we can kind of show you some of that right now. Okay, so at the end of this video, though, I want to show you. Bring your head back, Nicole, and bring your chin down to your chest. 3 really, really good stretches that you can do on your own. And it's not just stretches for the muscle, it's movement for the joints too, okay? And if you incorporate this into your routine on a regular basis, or you use it in conjunction with like an active program, an exercise program, it should relieve some of that stress and tension on the spine, okay? I'll digress into something that I think gets lost and utilized, and it's more probably of a... unfortunately, a little bit of a fear tactic in the medical community relative to imaging of this type of a problem, right? We get these images, and sometimes we're in pain too, so that will throw off the presentation of our spine. I call it antalgic positioning of the spine. But the anatomy might change over time, right? And we might see some of those changes occur over time on an image. And that doesn't dictate function, though. So what dictates function or movement problems like stiffness and pressure and tension and pain in the upper back is movement, all right? And so you have a movement-based problem more often with this. You need a movement-based solution. Head back for me, Nicole. And when I see someone say they've got some arthritis in their upper back, you can head down for me. Say there's a little bit of disc narrowing, right? So those cushions in the spine are a little less, right? Or decreased in size. And in extreme cases of a Dowager hump, you might see some changes in the vertebral bodies a little bit over time as well, right? You might see them kind of shift in terms of the anterior portion, get a little bit more wedged, is what we call it, right? Those are more extreme cases. And most of the time when people come in and say they have this, they don't have those extreme things going on. So just keep that in mind. So I say all that on the image. Head back for me. Chest up. Head back again. There you go. And that was a good example of how her chest body position just changed her neck function. Do that again. Go. Bad posture. Worse than that. Come on. There we go. Good. Now bring your head back. Do you feel limited?
Yeah.
Okay, now go forward. Sit up. Bring your head back.
Oh yeah, that's way more.
Okay, so if you've got better control, better positioning, your neck is kind of in the space it's supposed to be in, and it will act like it's supposed to act a little bit more, right? Let's do that again with the shoulder. Okay, here's an easy example. I tell people this is why posture is important, and you control your posture. If you're really tight and irritated, I help people get untight and less irritated. And then that was very clinical the way I described that one. That's all right though. And then go ahead and slouch for me again. A great slouch. Okay, don't practice that too much, Nicole. Let's see your shoulder now. Okay, come over here for me. Straighten the elbow. Raise your hand over your head. Oh, I know you can do it better than that. Okay, that was a little forced, but okay. She had to kind of go one of these to get that up there. Now, give you the nice posture that you hold naturally. Right there, good. The posture where you can kind of relax, but be up, not be like this. Okay.
Got it.
Yeah, you got it. Now, go ahead and show me the shoulder movement. Easier or harder?
Way easier.
Okay, so all I did, truly, is I took her mid and upper back from flexed to a neutral position, if you will, a more controlled position upright, and her scapula shifts a certain way so that her shoulder moves more effectively. So your posture dictates your function. So it is important to have control with these things. This is definitely important. Okay? So you can change your function, you can change your control. Sorry, I'll get back to your shoulders. What am I doing?
Touch me.
Talking, where? Come on. There you go, bring your head back for me. And then head down for me. My wife just says, get to work. She doesn't even let me talk. So this is a nice opportunity where I have the balance. Good, bring your head back for me. There you go, head down, nice and easy. You know, the function of those areas, sometimes you see this picture and you're like, oh my God, look how bad my posture is. Well, there's no changing for the most part what shows up on an image, okay? And that's a hard pill to swallow sometimes when you see some things. But you need to have that reality check, if you will, for the most part, as it relates to, let's just say some of the changes that occur over time, like arthritis or narrowing of that disc or some stress response due to, say, what we do for a living, like what I do for a living. But the reality check allows me to focus on what's important and what I can control, okay? Bring your head back for me. You feel me, Nicole? Mm-hmm. Am I connecting to you?
You are.
Perfect.
We're connected.
Bring your chin down to your chest for me. Good. All right, so with Nicole, we're doing a pin and stretch, some ART. When I go to adjust her, it's going to move so much easier, and I need a little bit of help with Nicole. Even though I adjust people all day long, Nicole back, it's kind of a little mighty in there. It's strong. It
Gives him a run for his money.
A little bit. A little bit. Head back for me. Here you go. Lift your chest up. There you go. Good. Head back again. Other way. Other back. There you go. Head down for me. Good.
Oh, yeah, that one.
Yeah, that right side. It's got a little bit more.
That's my pitching arm.
It's your pitching arm?
Yeah, I pitched with that thing for years.
Right on. Reach
bad.
across. Do you still play?
I do not. I should.
You should.
I should. I really would rather play volleyball than softball. Volleyball was my sport.
Baltimore's got some good sports organizations down the city, but they've got all kinds of stuff out here too. Shout out to Volo. All right, so this turned into an educational video from to a treat Nicole video.
Yeah, I like it.
So we'll get back to the education in just 1 second. Reach for me.
Oh.
Glad you got the laugh out of that, Carly.
Good weight hand, flopping around.
At least I got my nails done. You had to look.
You did.
I did.
You look good. Go
Thanks.
stand up for me. I did my daughter's nails last week.
So cute.
So surprised.
And she listens to my wife. She listens to me. I'm like, all right, now Scarlett, sit still. And she's like, what? Like, nothing. Like, I'm like, all right, I'm not doing this anymore.
That's awesome.
There's pain everywhere. All right, so you can, I'm going to show, you can lie. Follow me, actually.
Ooh.
Sir, do you mind if I use this table?
Not at all.
All right, awesome. Appreciate it. No, you're fine. You're fine. All right, Nicole, you're going to sit here with your feet up there.
Okay.
Good. And then you're going to interlace your fingers like this. Rest your hands. Sorry.
I know. Is it my clip?
I just don't want you to push your fingers on. Go ahead and take your hands right on top there. Good. I'll bring you back. Bring your elbows together. And then come down. Come back here. Open up. Now relax your shoulders a little bit. I'm going to grab onto your sides, okay? There you go. Good. You're ready to go home, aren't you? Mm-hmm. You still clocked in right now?
No, maybe. I'm doing a video.
Take a deep breath in. I'm just messing. Easy exhale, let it go. Good. A little bit more.
Oh,
Perfect.
yeah, that's it.
Sweet. Swing your legs to your left. All right. And because there's more to move on her, you're going to come on your stomach for me. There you go. Stomach. And you can relax on him. So just a upper back extension adjustment. We showed you how a lot of times that tension brings us here. This is going to allow her to move through these stretches a little easier, and she's not going to hurt as much up here. Scooch up a little bit for me. There you go. Take a deep breath. Easy exhale, let it go. Good. Good. Deep breath. Easy exhale, let it go. Good. Now lift your chin. Rest your chin. Good. Good. There we go. Okay. There you go. Scoot forward. I just have to keep telling myself, Nicole, never give up. Just keep working it. She starts to move really nicely on those adjustments. You know what I'm saying, Nicole? Okay. You're going to feel a little movement right there, okay? So this is T1, T2. This is how I adjust those areas, okay? I'm going to put extension, rotation, and lateral flexion into the joint. And she's nice and relaxed. You're going to give me another inch my way if you don't mind. That's perfect. Good. So you can watch me. Extension, lateral flexion, rotation. It happens quick. Just like that. And a little lower. Okay, T1 prominence, T2, edge, rib. I'm going to move her rib on this one just because I feel that restriction there. Okay. So I have to align a little lower. My elbow is a little bit more in line with that as well. And it's such a deep spot. I had to kind of get respect from her body to move her in the sense that if I just went in and pushed, she's going to guard. So I had to kind of finesse it. There's the finesse. You feel it kind of moves before I even get going?
Yeah, I like that.
Yeah. Okay. All right. So we did some ART, some soft tissue work. ART is just the name for it. ART providers are awesome. In my opinion, in terms of just their ability to kind of work soft tissue, massage, PT, chiro, they get trained in that program. If you ever need a good provider that does soft tissue work, I had to release technique. And then I did adjustments in her upper back, 2 different ways, out there and here. I adjusted her upper thoracic spine with those sideways adjustments that you just saw at the end. Cool? Ready to show the people how to do the stretches?
Sure, you want to adjust my low back too?
Yeah, sure.
You're the best. Yeah, that's the side that's killing me, the right side.
Yeah. Okay, do this for me. Lie on your side, this side up for me. I watched the Lego movie with, did he sing that song, Kick Push? Happy?
Pharrell Williams.
Pharrell Williams?
Yeah.
It was so good.
Wasn't it?
It was good. Did you see it?
I saw parts of it
Yeah.
because my friend's sister was watching it, and I was like, oh man, that looks good.
I was like, I'm about to watch a whole Lego movie right now. And
I want to watch
watching
the
it, I was
Lego
like,
Scooby movie.
Still kind of feels weird on watching a Lego movie, but it's actually kind of cool that he did it this way. And it was so well done. And I had so much more respect for Pharrell Williams.
Right.
That's right. There you go. So, I got you. Just a little release. Good. Come on your back for me. Lie on your side, this side, facing this way. You need a little bit of work on this hip over here and low back.
Yeah, I've
Some soft
had it
tissue
needled
work.
with Nick last week.
Did you?
Yeah, he did both sides.
Did it help?
Yeah, but afterwards, I noticed the knot a lot more. Like, I didn't notice it moving when I walked before, then he needled me, and now I notice it when I walk.
Yeah, it might just kind of be highlighting a little bit for whatever
Yeah.
reason. I want to give you some stuff to do outside of here, like some stretches.
Okay.
And some mobility work around this hip. I think it'll take some tension off the way you load these joints here.
Yeah.
Okay? But we can look at you like from an exam standpoint a little bit more.
Cool.
And see how you balance when you lunge and you squat. On this side. See, this side moves just fine.
Oh.
That's easy.
Yeah, see, it was the other side. Yeah, I felt the difference.
Let me do this for you. Okay, we're digressing to her hip. That's just a little tight.
Yeah. It's because, did I tell you I was born with my hips dislocated?
This one was.
Both of them were dislocated when I was born.
You had hip dysplasia as a kid.
Yeah. Like I came out and they were.
Did they put you in a brace for a
Yeah,
while?
I have the brace still.
Do you?
I do.
Pretty
It's in my
wild looking.
attic.
Yeah, my
cool.
niece had that.
Yeah, it was crazy.
Got a little traction.
Oh yeah.
Okay, grab my hand. Sit up with me. Good. Swing your legs this way. All right, so 3 stretches for Dowager's hump, okay? Come face me. Sorry to put you on your knees at the end of the long day. But, all right, so we're gonna get on a chair. We're gonna get on like a ottoman or even into the couch. This is a really simple way to put some extension, similar to the adjustment that I did, into our upper back and move it in that way. We're gonna floss the joints back and forth. We're not gonna sit there and statically just hang out, because joints don't like that. They like to move, okay? And so this is gonna be a repetitive routine that we do 10 times, okay? And then we're gonna break it down, do it slow. So watch, prayer. Go ahead, elbows up, good. Hips go back a little, good. Go ahead and look up, good. Now drop your chest to the floor. That was really good. You kind of shot back on me. Okay. Try to think about keeping your head up. Head up. Good. Now drop your chest down from there. There you go. Good. Okay. Do you feel your upper back is getting stretched? Now take a breath through your nose. Exhale through your mouth and sink. Don't let your elbows come off though, because it's going to become more of a shoulder if you do that. There you go. Good. Yeah, I feel that. Like a lat stretch as opposed to an upper back movement. Okay, come back and restart it. So it's going to look a little like this. Let me just go through one. Drop down, head up, sink. I might even get a little release when I do it, a little adjustment, okay? Yeah. So try to keep your body from going down and in. And think about your upper back kind of curving the other direction. Okay. Say a little prayer while you're down here for the world. For everybody.
Save the world.
There you go. Go ahead, Nicole, send it out there, okay?
Peace, love, and happiness.
There we go. Come back up. Oh yeah, Horn. Peace, love, and happiness for all. Hey, right here from Baltimore. We're going to save it, baby. Here you go. Head up. Good. Drop. All right. So I'm telling you, this is one of the more powerful, especially if someone's like, my rib is killing me. It really does help it with pain, but it helps with function too. It helps move your upper back and stretch you the right direction. And when you go to lift, when you go to work, when you create that stability on your own, you're going to be in a better position to do it as opposed to being like going in the gym like this and getting strong. Okay? Or whatever you like to do. So there's your upper back stretch. Okay? I got 1, 2, to the chair. All right. How do we get to that rib adjustment that I showed you where I moved her head? And I'm going to show you how to do that on your own. Okay? Just to gently stretch those joints and move her neck. So we're going to go through Mackenzie 3s. Here you go. Sit here. And Mackenzie is just the name of a group of stretches. Movement patterns for joints. Sit all the way back for me. Actually, you can go up like that. That's cool. And then, Carly, do me a favor. Come on over here. So we're going to go chin retraction. Don't go so far down. Go straight back like you're avoiding somebody. Then go back into extension. Keep going. Relax your shoulders though. Okay, don't be like this when you do this one or it'll just feel hard. Let your chin go lead the direction. Yeah, there you go. Good. Now in this position, you're going to turn left. Good. And you're going to turn right. Wonderful. Good. Come back and go back farther. Good. And then relax. Okay? So let me show you through it again. Okay? Chin retraction, nice and light. Extension. Keep going, keep going. This is a very helpful tip. Lift your chest up for me. Perfect. Now turn left. You feel how it got a little deeper? Turn to your right. And what I mean by deeper, I mean where my finger is pointing back here. And then come back. And let your head go farther back. Good. And then come off of it. Good. Do you have to sneeze?
I have to cough.
You have to cough? Carly, take a... And then edit.
Cut.
Resume.
Oh no, I think that was pretty real. It's
That was
okay.
pretty good.
Go ahead and remember, don't let your shoulders go here. Be there. Here you go. Good.
Wow,
Just in
I'm like,
control.
I just do that, don't I?
Everyone does it a little bit. It's okay. We just have to try to find that element of control because we just do a lot of this. Anyways,
That's so true.
Jim, here, head back. Go, 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 go. Good. Pause. Relax. Good. Turn left. Beautiful. Turn right. Wonderful. And come back again. Let the lady call.
I'm recovering from being sick.
So I won't be in the office tomorrow, okay? So Carly just got us, but no, I'm just kidding. All right, cool. So go ahead and stand up for me. 10 times, right? And you can work with that. Listen to your body. If it's too much, obviously, be mindful of those things too. But I would do these 20 times before a workout. I would do these 20 times before a workout, or when I'm feeling like I'm kind of going that direction. And you can add it to your daily routine if you're that committed. Good for you. It's not my show. It's Nicole's show.
Is it?
It is.
All right.
All right. I mean, you want to adjust me? That turns into my show.
Do you want me to adjust you? Is the question. New doctor.
Oh, soon. Angie.
Facts.
Okay, let's see it. Put your hands up there. Nice, good. All right, now show me how it's done. Nice, easy. So thoracic extension, cervical spine extension with rotation. Now we're doing more purely thoracic rotation. We're gonna relax that shoulder down. There you go.
It wasn't me.
It wasn't you.
You can't cough and they say it wasn't me. That was good.
We're getting some water in a second, Carly. I got you. Just leaving her hanging there.
Do we need an assistant to get you some water?
Hands up. So thoracic rotation, T-spine rotation drills. These are so good. Stay upright in your spine. Don't lean forward there. There you go. There, right. Stay over that hip, if you will. Okay, that makes a difference. And then come back. Eyes will follow. Body will follow the eyes, if you will. Perfect. Good. Try to pin that there. Push that against there. So I'm going to have her drive her knee against the wall and then come back. Just move it to where you can get to. Each time it's going to go a little bit farther, which is an awesome thing because you're getting better motor control with the pattern of movement. Good. Don't let your torso tilt that way. I'm going to drive you up a little bit. There you go. Good. Relax your shoulders down. Make it smooth. Be like a...
Okay.
Like a
Swan.
like a swan.
I like that.
Go ahead. Good. Last one. Good. So she's pushing her knee into the wall. She's focusing on her mid-back, doing the rotation. She's opening up. And then I'm going to give her a little bit of a tip here. Go ahead and go back again. Good. Pause. Try to reach towards the spine. Ah, beautiful.
Ooh, yeah.
Now go to the wall.
Whoa.
A little extra on the torso. All right, so she'll do 10 each way, okay? 3 stretches. 20 reps total each. 60 reps all together. Did we do that right? Yep. And then when you get that done, probably about 3 to 5 minutes, 5 minutes, let's be real, that's not a bad little routine to take some stress off your upper back. And if you keep working on it, it really will improve your function, okay? So don't be scared of the x-ray or the MRI in those areas. Focus on what you can control, which is your movement and your strength, okay? And these are 3 simple ways to take power of the ability to move in your upper back and neck and to decrease some of just the day-to-day grind that we all got to do.
Yep. We all do it.
Most of us do it. Thanks for watching.
Thanks.
Hello everybody, Compilation Chiropractic here. We are going over Webster Technique and how that works with pregnant patients. So Webster is a chiropractic technique that involves a few different pieces that go together that help with pregnant patients in order to make sure that the pelvis is aligned well, helps with low back pain, helps with that pubic symphysis pain. It can also help with like the sacral pain or the pain that can happen down low. So here we're working on the psoas and we're doing a release there, which is part of the Webster Technique, where you look at the alignment based on the tightness in the hips and the tightness that can happen through the backside as well as the round ligament around the front. So student Dr. Kendra here is working on that psoas release, so she's getting more on that internal side. In cases where baby is either moving around a lot or seems to just kind of want to be hanging out in one spot, it can help just stimulate some activity for the baby and for mom in order to help throughout the pregnancy as far as keeping things aligned, keeping them moving well. I always tell people there's no guarantees if the baby's breached, there's no guarantee that we're going to turn the baby, but we always advocate for throughout the pregnancy, especially into that 2nd trimester and forward, to continue with some pretty steady chiropractic care, whether that's once a week, twice a week, to help out with whether we're dealing with pain or whether we're dealing just wanting to get better function and movement for the mom throughout the pregnancy. Yeah, and then we always tell people, like, based on how they're feeling, how they're moving with it, that we want them to continue to move as they feel comfortable, whether that's exercise, walking, working, all the above.
And then as they get closer to their due date and delivery, they can come in a little bit more frequently if they're feeling like things are a little bit harder to deal with, or if they're feeling like, hey, I just want to make sure my body is prepared and ready to go. But yeah. That was the dad?
That was the dad out
He was
there.
peeking in the door. But I'm gonna let Dr. Kendra continue with her examination and her Webster process with our patient here.
Baby's moving.
There's also mapping and things that you'll see Kendra's doing where she's pressing her fingers into the belly, and we can actually feel where the head is, where the butt, where some feet are hanging out. So you can kind of get the alignment of where the baby's hanging out.
Really moving.
A lot of times with Webster, you'll get a lot of movement happening where it's just like, woo, excitement. There's freedom to move a little bit more if there is any like tightness happening on one side of the pelvis or the other. But yeah. Kendra, you good?
Thanks, Dr. Andrew. Yeah, thanks, Nicole. Baby always likes when I'm right here, I've noticed.
Right? I think their head is so close to those sides
Yeah.
that they're like, oh, they're definitely very responsive to touch.
Baby's like, who is that?
Right? Can you hear us?
So how has this pregnancy been for you so far?
Well, really good. And I mean, since I started coming twice a week to do all of this alignment and regular adjustments, I was going through discomfort and growing pains. And it really is. I was telling Warren, I'm like, I feel good. I feel like I can work out harder again.
I love that.
Yeah. There's days that I'm like, okay, I'm held back. But I ran for the first time yesterday in
How'd
a
you
few
feel?
weeks. Great. I felt pretty normal.
Good.
I mean, I ran a mile, you know.
Yeah.
It's about my limit. Then it starts getting just tight.
Yeah.
Like, okay, that's good. Still felt good though.
Yeah, good.
Just want to keep it a little, so it's not too long before I do it all again.
Okay. I'm gonna bring it up and then I'm gonna flip. Have you flip onto your belly. Alright, I'm gonna bring the table up. And for Webster Technique in our office, that's kind of what you can expect if you come in and you're pregnant. And yeah.
Thank you.
You're welcome.
Hey everybody, this is Dr. Warren here with Mike. Mike's a chiropractic assistant here in our office. We are in Baltimore, Towson, Maryland. We're an integrated practice where we provide chiropractic, manual therapy, massage, primary care, functional medicine, personal training, just a kind of a confluence of different providers and people here, and it's an awesome team. And one thing that comes and sees us quite often is vertigo or dizziness. Now, you can have this come from quite a few different areas relative to what causes or establishes that baseline of vertigo. And so, having a proper diagnosis and having a proper treatment plan for it is really important. But one thing we do know about vertigo, especially vertigo and the origin of benign positional vertigo from the inner ear, is proximal positional, so BPPV, where the thing that gives us awareness of space that is aggravated. It can be the eyes, it can be the inner ear, it can be joints, neck, etc. From a balance standpoint, is the Epley maneuver is very effective for treating that. So the Epley maneuver is amazing, and it's kind of the gold standard for treating vertigo for patients in general. But one thing it does cause quite often that can be a little bit uncomfortable is it can cause a little bit more of that dizziness in the moment or the periods after using it. And for people that that are coming to see me and they're like, and I've got to get on a plane at 4 o'clock today, I'm like, all right, well, how do I find this balance with helping this person out? Or in the other case that came in, I need to get my hair cut at 2 o'clock, and I'm like, really? Okay. Like, how badly do you need that haircut? Anyways, and so with treating it is that's the Epley maneuver. With understanding it is or diagnosing it, right, is using a good history. And there's some things that we need to rule out in some cases, but oftentimes the history, as well as using simple orthopedic maneuvers like the Dix-Hallpike maneuver, where basically I bring them back quickly and turn them to the symptomatic side, and I look for nystagmus or twitching in the eye, right? And then also there's symptoms to occur. So kind of coming full circle, like, what's this video about? You've tried the Epley maneuver maybe, or you're just curious about vertigo because you probably might have those symptoms. And this is a maneuver that has been very helpful for us with some of the cases that the people overreact to with the Epley maneuver or are not responding to. Okay, and by overreacting, it's like they're getting way too dizzy doing it. It's too much, right? And which can happen. So if this is something that that you're contemplating doing at home, be mindful, right? It can make you dizzy, so have somebody there at home and make sure that you're getting proper and good support in the process of doing it, right? Because not all dizziness vertigo is alike. So for Mike, we'll show them the Epley maneuver. And have you gone through this with me before?
A few days ago, yes.
Awesome. So
got
you know exactly
got a little
what
peek
you're
at
doing, right?
Yeah,
you remember everything perfectly? No, I'm just kidding. All right, so we'll get started. And let's just say Mike comes and sees me and he's like, we're going through things. He's like, and I've been having it more recently. Kind of comes and goes, but last week was just, I had a string of really bad days. And, I notice it if I'm rolling on my side and I'm sleeping on my right side at night and I'm starting to get those sensations, or I turn my alarm clock off because I want to sleep in and be late for work, and I touch that, press that alarm, and I turn and the room spins. The room spins. I have a feeling of uneasiness, right? And so that's very commonly ways described. I'll always look at cervical spine. I'm a chiropractor. I look at the spine as for a lot of root causes of things in general, but I'll oftentimes find joint fixations in the upper cervical spine along the symptomatic side. Okay, but my job as a chiropractor is to, from a spine standpoint, when I'm doing manual therapy, is to motion palpate, find where there's joint restriction, where their function is impaired, right, from a movement standpoint, and treat accordingly. Okay. All right, you're like, get to the point, right? I know. I'm going to show you how to do the Epley maneuver. So swing your legs up here for me. And so I've examined him from a neck standpoint. I've established that he gets vertigo with right-sided cervical rotation. I've gone through a history relative to any trauma, any history of eye or vision problems. We talk about migraines a lot with these cases too. Autoimmune is also a component that I want to kind of sink into. But all right, he's a classic presentation for a good candidate for Epley maneuver. So scoot back about a foot this way. All right, he's got right-sided vertigo, so he's going to turn his head to the right. Oh, you guessed right. 50% chance you got it. All right, so you're going to turn to the right and go back, straight back. And then I'm going to take him to 30 degrees of extension off horizon or off the table, 45 degrees of rotation, and then scoot towards your feet a little bit. The best is to really hold the person there, and when I'm doing the manual therapy, but on the edge of the bed as I'm educating people on this, this is kind of a good angle, if you will, Carly, show me those skills. Get down there and show people that his head is not here, but it's slightly tilted. I'd say 30 degrees, and then rotationally about 45 degrees. My wife thinks I don't have good spatial awareness. I think I have exceptional spatial awareness. You be the judge of that one. Someone can use a measurement tool for that. And so we sit here for 45 seconds, a minute, wait for the dizziness to go. If I'm doing this on somebody, open your eyes for me. I look for any nystagmus. He doesn't have vertigo, so he's not going to have it. And not all cases that have it, that have a good response to epi maneuver, not all cases that we see will have that nystagmus occur in the eyes. All right. Good? Mm-hmm. All right. You tell us, you tell the people that are going through this at home, what do you do next?
Turn to the left side.
What degree?
Turn to the same thing, 30 degrees. 30 degrees flexion and then 45 degrees lateral, right?
Close. 45 degrees of rotation off of midline to the left, 30 degrees of extension, and you got to get it wrong before you can get it right sometimes. Good job, way to try. All right, and then so relative to that, he sits here for a minute and for his symptoms to abate. And then the literature doesn't tell you to go through it twice. I always go through it 2 times through. I work the person's canals twice, especially if they're not severely symptomatic in the moment, right? Which oftentimes they drove here, they walked in through my door, they're not laying on the floor, right, with me. That can totally happen. Just happened yesterday to a patient of mine, at home, that is. Where she's like, yeah, last week, it was like 2 days, like I had to take something to take the edge off of it, right, which can help. After a minute here, he's gonna go on his side, he's gonna be facing that way. It's gonna be awkward because I have a curtain here, and I usually move that curtain, so I'll do that. Make sure there's not a patient behind there. I am good. Thank you, Nicole. And he's turning his head how far to the left?
This part I haven't seen.
What?
I haven't seen this part.
He's like, you didn't show me this.
Nope, not this.
All right, here and here, 45 degrees, hanging out. Okay? And so I might put a pillow underneath their head. I might just hold them in this position just to give them that stability. 1 minute here, okay? So he went on his back. He turned to the symptomatic side, 45 degrees of rotation, 30 degrees of extension. Then he turned to the asymptomatic side where he's not feeling the nystagmus vertigo when he turns. And then he rolls to that asymptomatic side at 45 degrees of just straight rotation. There's no head tilting back in extension. There's no head coming down in flexion. It just stays right here, okay? And then after a minute here, or till the symptoms abide, I help him out. This is a great way to sit somebody up. Arms crisscross, grab your elbows. This is more for Mike than you at home. I'm gonna hold here, I'm gonna here. Go ahead and swing your legs as I pick you up. Oh, me.
Oh, to you.
Yeah. Let's try that again. That was so awkward. Let's go one more time. So you're gonna swing your legs out to in front. Okay, 1, 2, 3. Boom, pop up. There we go. Good. Okay, it's smoother, I swear, most times than that. So we did the epi maneuver. Okay, Mike's like, that was brutal, or no effect at all. Okay. Another thing that I can do is called the half somersault. Okay. And so what we're gonna do, you're gonna do like me, okay? So you're gonna come up onto the table like this, and your hands are gonna be here and here, okay? And you're gonna go ahead and put your hips back just a little bit, and your head is gonna go into extension, okay? You're gonna start here. You're gonna wait till the symptoms stop, right? And so no dizziness in this position, wait till that happens. You have right rotational vertigo, so you're gonna go here, head down, turn your head to your right at your elbow. Good. And put the crown of your head in more flexion. Good. So you're going to stay in that position, okay? You're going to wait till those symptoms abide. You're not having the vertigo anymore. From there, you're going to go to quadruped. You're going to come up. You're going to keep your head tilted to the right. Okay? You're going to wait till those symptoms go away as well, okay? Now it might be 15 seconds, it might be 5. Once they are, you're going to extend your head up and to the right. This is a little easier, not so far to the right. Right there, now look up. This is a little easier to manage for somebody that might have a hard time falling to their back and tilting their head or laying on their back and getting up quickly. So I like this because it's a little bit more of a grounded position for him. Okay. All right, symptoms are gone. Relax, sit back onto your hips, and then look up. You're gonna repeat the process. Okay, so I'll go through it twice. All right. Half somersault. And there's videos from the MD that came up with this protocol for treating the inner ear for BPPV. Great technique, and we've had good results with it for the people that don't respond well to the epley. So if you're one of those people as well, it's a very safe, effective thing, and it's like most of these maneuvers, it's very, in most cases that need it, it's very helpful. Okay, so we'll try this. It really kind of is a full circle approach on that condition. Like I said, you can set up. I'm a chiropractor. I closely examine the neck, and I'll do manual therapy adjustments and treatment to that area because that area is so closely correlated with balance, with issues of like when there's noxious stimulus in the upper cervical joints, it can cause some of that aggravation as well. So you can have cervicogenic vertigo as well relative to that area. Sometimes people have more complaints in that region when they have it. So they'll say they get like kind of burning pain here, tension headaches, pressure on the back of their head. They might not know what that's coming from, right? Like they don't, oh yeah, it's my occiput and my upper cervical joints, they're stiff. They just like, oh, it just feels like a lot of pressure back here, right? And you can examine that. And you can really easily examine that through motion of the cervical spine. So those people, well, I'll tell them, they'll be all right-sided in presentation, kicks it off, and then I'll have them tuck their chin. You can do it. Turn your head to your right in that position, okay, where I'll passively do it. And don't try to aim for your shoulder. Try to actually, here, I'll guide you. Bring your chin down. And so my hands will be here, and I'll just guide them. See how I'm kind of turning as opposed to going like that. So keeping your chin in flexion, and I'll rotate. Good, I'll feel through here to see how it's approximating and moving. And then I'll do the same thing. You got a little something right there that can use some TLC on. You're trying to lift too much in those military press positions overhead, man. You need to take it easy in that gym. Okay, so Mike's going to chiropractic school. I'm excited for him. He's one of the exercise specialists here, and he jumps over, and he's a good sport, and I appreciate it being in the video. I hope that it helps you if you haven't tried the epley maneuver for vertigo. It's such a good, safe, effective treatment for a lot of people. And at the end of the day, in most cases, if it doesn't work, it's just like a good neck stretch, right? And then the other position, the relative to the hunter half somersault, is something we've used over the last couple years a little bit more. Highly effective for sure as well for that. I hope that helps you. I look forward to putting out more educational videos and content. And if